So this study sought to evaluate how having medical students teaching nutrition classes in the community might change their medical knowledge, the way they plan to provide care to their patients, and their own health habits. As background, though we know that nutrition is an important part of preventive health and of management of chronic illnesses, very few medical schools dedicate significant time to teaching practical nutrition. To try to help remedy this deficit, the Keck Primary Care Program, which is an educational track for students interested in primary care, partnered with the LA County Wellness Center to train students to teach nutrition classes for the local community. Each year, first-year medical students teach a total of 24 classes for the community, as well as an annual Diabetes Day educational event. Our study sought to evaluate the impact of teaching at the Wellness Center and at Diabetes Day on medical students immediately after teaching and then 1 to 4 years after teaching, looking at students' nutrition knowledge, confidence in counseling patients about nutrition, and personal nutrition habits. We surveyed students who had taught nutrition classes between 2017 and 2020. In phase 1, students were surveyed immediately after teaching. In phase 2, they were surveyed in August of 2021, anywhere between 1 and 4 years after teaching. Survey questions were open-ended and closed-ended, and none were required, so response rates varied. For the results of phase 1, immediately after teaching, students reported having learned about topics like macronutrients, portion sizes, glycemic index, and metabolic syndrome. Approximately half of students reported that their experience teaching would make them more likely to discuss nutrition with their patients, and about 1/3 said they were now more likely to make culturally appropriate food recommendations to their patients. For the results of phase 2, when the students were surveyed between 1 and 4 years after their teaching experience, nearly all students, so almost 90%, strongly agreed that teaching the nutrition classes had improved both their knowledge of the principles of nutrition and their confidence in communicating with patients about nutrition. Students reported that their teaching experience made them more likely to counsel patients about multiple nutrition topics, from sugary beverages to portion sizes. In their own lives, more than half of students reported that teaching had inspired them to reduce their portion sizes, drink more water, and eat more fruits and vegetables. The study did have some limitations, in particular a small sample size and no control group of students who did not participate in teaching. But in short, medical students who participated in service learning nutrition education classes reported improved knowledge of nutrition and confidence in counseling patients, and these improvements were sustained over time. Also, students reported making healthy changes in their own nutrition habits as a result of teaching the class. We believe training medical students to teach nutrition may provide a valuable service to the community and a formative learning experience for students that will better prepare them to counsel their patients about nutrition in the future.